morning. I'm Dr. Jessica Sapoff, and you're listening to Dental MD on KKNW 1150 AM. Today, I'm going to talk about choices in dentistry. Now, choices are going to be given to you in any dental office, but if you go to most dental offices, you are getting the mainstream, regular, American Dental Association approved choices, and those are fine. Though you need to know what those options are when you have a problem with a tooth or jaw or whatever the problem is. But there's an entire world of natural and holistic thinking based on the principles of natural medicine, which leads us into an entirely different realm of philosophy and choices for treatment, because the overview of, the understanding of health is completely fundamentally different. It is fundamentally different. If you go to a holistic, biological, natural, you can pick whatever word you like, office that practices dentistry, provides dental services, you will get a completely different, you'll get those choices, but you'll get more information about those choices and other choices, and the information about why you might make one choice over another. Well, I've been practicing holistic dentistry for over 20 years, and I've been a dentist for 30 years, and I've seen a lot come through, our profession. I've seen a lot of change. I've seen a lot of evolution of materials and techniques, and not everything is, just because it's new and high tech doesn't necessarily mean it's a better choice. Sometimes it is. Sometimes it is. So I'm going to talk about choices, and I'm going to just go over my list of frequently asked questions that we hear people asking, or that people come in with a situation and I give them choices, and I can tell you what some of the questions are about, what the different choices are. So this conversation today may help you to ask different questions. It may help you to do a different search online, because when you get new information, that works its way into your searches. When you do research online, or when you're asking questions sitting in the dental chair or their room where they do treatment plan consultations, or whatever they have at the whatever dental office you go to, your information that you already have is going to shape and inform the questions you ask. So that's really why I'm here. That's why I do this show. I want to broaden your understanding about what's available so that you can get curious. So you can wonder, I wonder whether that would work in my case. Whatever it is, I want to inspire that curiosity, because then that's what helps you to ask the kinds of questions that really get you to answers that work for you. All right, that's enough philosophy. Let's get on with the questions. So the questions that I'm going to be going through today, I'm going to talk about wisdom teeth, whether you should keep them or remove them, and in what circumstances, and at what age, and all that kind of stuff. When the second question is if a tooth dies, or if it's dying, or if you already have a dead tooth that's been there a while, treated or untreated. What are your choices? What should you do? What are the issues? How do you make a decision about what to do next for that tooth? All right, and the third question is metal versus non-metal restorations. Why would you choose one over another? When would you when would you choose one over another, under what circumstances, and what are the non-metal choices and what are the metal choices, and what do holistic practices usually offer and what does everybody else offer? Okay, and the fourth question will be fillings versus crowns or onlays. When do you want a ceramic or gold restoration versus an ordinary filling? What condition of the tooth dictates what those choices are? What would be borderline where you could go either way? And I'll talk about teeth and the conditions of the teeth and why we restore them the way that we do. Some restorations are more conservative and some are more aggressive. Okay, and then the fifth question is about sedation. Children and adults sometimes need sedation in order to have treatment comfortably. And I'm going to talk about what some of the issues around sedation are so that you can make choices for yourself and your children regarding whether you want to do that and whether it's necessary. And in some cases, it actually is necessary. So that's fine. We'll talk about that. And then the sixth topic today will be orthodontics and what the difference is between orthodontics and orthopedics and how the two work together. So the jaw joint and the tooth position and bite position, that issue, because there are a lot of different ways to do ortho. There's much more to it than just having the front 6 teeth look straight. So, and in some offices, that is kind of all they focus on, and we'll talk about that. Okay, so let's go back to our first topic, which is wisdom teeth. A lot of times in this show, I have wisdom teeth last on my list, and then I run out of time and don't end up talking about wisdom teeth. So today I'm going to start with wisdom teeth. So let's say you have a teenager that's 16 and you want to find out whether they have wisdom teeth and should they have the wisdom teeth removed. Okay, so we take a certain type of x-ray that can really show us that area of the mouth, and that's called a panoramic x-ray. You might sometimes hear it just called a Panorex. That name was a specific brand name of a panoramic x-ray machine in the past. So sometimes you'll hear it called a Panorex, but the correct term is panoramic view or panoramic x-ray. And that you step into a machine and hold on with your hands, and you bite into a little tab to help steady your head so you don't move during the x-ray. And then the machine moves around you. Nothing goes into your mouth. You just stand still, and the machine moves around you, and then it gives us a view that goes all the way from one jaw joint to the other. It shows us the lower edge of your jaw and all of your teeth and the bottom half of your maxillary sinuses. On that view, there are a lot of things that we can see, but one of the things that is the most important that we're looking for is our wisdom teeth, and we can see them in this view. We can see, it's a two-dimensional view though, so if there's any question about where the wisdom teeth are relative to the inferior alveolar nerve, which is the large nerve that runs all the way through the jaw, then, because that nerve can get injured when the teeth are removed, if there's proximity, which means if the tooth roots are close to or worse wrapped around that nerve down below. So if there's a question about position like that in the x-ray, then you follow that with a three-dimensional x-ray, sometimes just called a cone beam for short, but it is a 3D image. It's using a very similar or sometimes the same machine to do a slightly different x-ray, and that lets us rotate the image on the computer screen so we can see the front, the back, the sides, the top, the bottom, and we can look at different slices or levels and see exactly whether that tooth is just superimposed over the nerve in the 2D x-ray or whether it's really sitting on top of or around the nerve. So if there is a risk that taking out wisdom teeth is going to cause severe problems with the nerve or other issues, sinuses, etc., and the tooth is not in a position where it could cause problems later, then sometimes it's better to leave the tooth alone and just leave it in there. But not everybody agrees with that. Leaving a tooth, which is supposed to be erupted and be chewed with, buried in the bone where it really doesn't belong, is, in some people's view, that would be asking for trouble later. So the question, really, the most common question is, does my child have room for their wisdom teeth? And if there is room, or it looks like there might be room, and the child is not finished growing and the teeth are not sideways, tilted, impacted against the next tooth, if it looks like there could still be space, a chance of space, then I think the teeth should be left there for the time being, and a follow-up x-ray should be done in a year to look again and see whether those teeth are coming in where they belong. So I tend to promote waiting if there's any question at all about whether there's enough space. Now, I'm going to talk some more about how those teeth are positioned and under what circumstances it makes sense to remove them. What kinds of problems can happen if you leave them there and there isn't room? I'm going to talk about that when we get back from the break. You're listening to Dental MD. I'm Dr. Jessica Sapoff. I'll be right back.
Some knowledge belongs to us and us alone. The way our girlfriends walk, the way they talk, the way they touch their hair. We hold details that only a sister can know about her girls. But what about our other girls? The ones that we carry with us every day. Can we describe them when everything's right? Can we feel when something's wrong? Our bond with our sister girls gives life. But knowing your breasts can save it. Go to knowyourgirls.org for the facts you need on breast health. That's knowyourgirls.org. Brought to you by Susan G. Coleman and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Get inspired every hour right here on Alternative Talk, 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm talking about choices in dentistry, and I'm going over frequently asked questions, and I'm starting with the topic of wisdom teeth. In the last segment, I talked about whether there's space and why you might want to just wait and take another x-ray in a few minutes, a few years, a year or two, to see whether there's enough space and whether those teeth are coming in straight. However, sometimes people come in and we take the x-ray and the teeth are, first of all, sometimes people don't have all four. They might have one or two or three or four. And we've also seen people with an extra wisdom tooth. Now, the wisdom teeth are also called the third molars. You've probably heard that. Third molars equals wisdom teeth. And the first and second molars come in at age 6 and 12, and the third molar comes in around anywhere from 16 to 19-ish. So we have seen people with a fourth molar, where usually it's tiny and it's way up there near the sinus, behind the last tooth. So sometimes those have to be removed too. That's a lot more rare. But that's one of the things that we find when we do the panoramic. And I know a lot of people don't want to have x-rays because of the radiation, but there is no other way to find out what's under there. And sometimes there are surprises, like fourth molars. So with the wisdom teeth, if we take the x-ray and we see that, first I'm going to define what impacted wisdom teeth means. What does impacted mean? It literally means that the third molar has made impact. It's touching. It has contacted the next tooth, the second molar, but impacted means that it's stuck. It has contacted in a way that is now preventing it from coming in the rest of the way. So it might be caught on the neck of the second molar, and once that happens, then the tooth the roots start to move, and the tooth goes more and more horizontal. The more horizontal it is, the more bone has to be removed in order to remove the tooth, because it gets sort of more buried up in there. And that's not good. So when we see that the tooth is impacted and that it's not able to finish coming in, that you want to get it out of there ideally before the roots finish growing, because they get longer and longer in there, and then the defect in the bone that has to heal once the tooth is removed is bigger. And also the roots might grow longer and end up much closer to that big nerve that I mentioned in the jawbone. And the other problem is the tooth will move and become horizontal. Usually the lower teeth do this. They become more and more horizontal, and then more bone has to be removed to get them out. So when is it okay to leave impacted wisdom teeth in? Well, it all depends on the gum tissue at the back of the second molar. If the tooth is impacted, but it's kind of almost erupted, or maybe even partially erupted, like part of the tooth has actually come through the gum tissue and you can see it when you look in the mouth or feel it. In that case, now the bacteria from your mouth can get down under the gum and down around that tooth and into the bone where you can't get at it or clean it. That's a problem, because if any of that tooth is exposed, or if the gum tissue at the back of the second molar is, if you can, we as dentists can take an instrument and feel down the gum tissue behind the second molar, and sometimes you can get all the way down. You can actually feel the tooth down below. You may not be able to see it above the gum line yet, but if we can contact it and feel it, and there isn't any, it isn't sealed off down below so that it's protected from the oral fluids and bacteria, in a case like that, it should be removed. I have seen teeth like that have a communication with the oral fluids and bacteria of the mouth, and that bacteria gets all the way down the back of the root of the second molar, and I've seen people have so much damage and decay on the root of the second molar that they end up losing not only the wisdom tooth, but the second molar as well. So that's not a situation you want to allow to progress. If there's any danger of that happening, it's better to take those wisdom teeth out. So when somebody is 16 or 17 and they don't have any gum problems, and there's still a seal behind the second molar, that's fine. However, that's a young person who hasn't had any gum problems. Many people, by the time they're 30 or 40, have some recession, they've got some attachment loss. The seal of the gum tissue to the tooth has moved down the root. If that happens in this area, you could suddenly find the wisdom tooth way down below suddenly has an opening and there's an exposure because the seal has migrated down the back of the root. And now the wisdom tooth has saliva and bacteria that can access it. So if you leave it in when you're 19 or 20 because it's down below and it's sealed, that doesn't mean it's going to stay that way. Later in life, that seal may be compromised, and then that tooth down there will have bacteria going down and moving all around it down below in the bone. So this is now an infection in the bone. And it's a bigger deal to have your wisdom teeth out when you're 40 than it is when you're 19. So if it looks like that is something like the seal is small or short or not very, that it's likely that in a couple of decades that seal could be lost, then it's probably better to simply get the teeth out when you're a teenager or a young 20. It's easier to heal. The bone is easier to work with at that point. It fills in better afterwards. I've seen people with large, deep defects in the bone behind the second molar after the wisdom teeth are removed because the bone and the tissue attachment didn't fill in correctly or seal well. And I've seen people with very deep gum pockets and infection behind the second molar where the wisdom tooth used to be. So I think that's the chance of that happening is minimized when you get them out at a younger age. So those are some of the issues around why to remove them and when to remove them. But every case is different. I think if you're having a wisdom tooth removed on the top or the bottom, it's a good idea to have the other one that would, even if there's room for it, that would come in and chew against that one, because you don't want to have a tooth come in and have it be unopposed, meaning it has nothing to chew against. So if you're getting one out, get the pair out, and most of the time it's going to be all four. All right. The next topic will be dead teeth. I know that's kind of a blunt way to put it. Non-vital teeth. Teeth with necrotic pulps or root canal treatments that have already been done. We're going to talk about some of the issues around that when we get back from the break, but the main idea is that once the nerve, which is soft tissue, the pulp tissue inside the tooth, once that is becoming non-vital, whether it was through infection or trauma, that tissue, once it is necrotic, is now officially gangrene. And that's a medical term, but technically that's what it is. And if it was because of decay, it'll be infected inside. But if it was because of trauma, there won't be any bacteria inside, but it's still necrotic soft tissue inside the tooth. So this has to be dealt with. You can't just leave it there. A lot of the times these hurt, but sometimes they don't. And so sometimes people think it's okay to just let it sit there. So we're going to talk about those issues when we return from the break. You're listening to Dental MD. I'm Dr. Jessica Sapoff. And if you have questions about the topics today or any topic in dentistry, or you'd like to make an appointment to come in for an exam and a cleaning or some dental treatment, you can give us a call, 425-427-8899, or you can reach us by email and get your questions answered. That is appointments@naturaldentist.com. All right, when I return from the break, I'm going to continue discussing choices in dentistry and frequently asked questions. I'll be right back.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Like many other cities, Chicago has a combined sewer system that moves rainwater and wastewater in the same pipes. So heavy rains can overwhelm the system, flooding residents' basements with untreated sewage.
It's just horrifying.
Lori Burns is a lifelong resident of the city's south side.
There's a drain in the shower, and water would be bubbling up from there. And then when the storms are really bad, the toilet would back up. So instead of the water going down and out of your house, it's coming back through the toilet.
As the climate changes and the Midwest gets more heavy rains, improving city infrastructure will be critical. But homeowners can also take action. The nonprofit Center for Neighborhood Technology helped Burns plant a rain garden in her yard.
We planted native species that have very, very deep roots. So they're able to take up all of that rainwater that's coming off the roof, and then you've got a beautiful garden that you and other critters in nature can enjoy.
She also installed a backwater valve between her sewer line and the city's. When the sewers are full of water during a storm, the valve shuts.
And it's kept my basement dry ever since.
Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150 is your sports organization's safe bet when it comes to airing your team's games. Our players are all seasoned professionals when it comes to sports programming. Imagine your games being heard on local radio. Your team deserves the MVP treatment. Call 425-653-1150 today to learn how affordable and fun it is to broadcast your games on the radio. Call 425-653-1150 and make your next season something special. That's 425-653-1150.
Going our own way every day. Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm talking about choices in dentistry. I've covered wisdom teeth and some of the issues and questions and choices that people have regarding whether to remove them and when to remove them, etc. And I've started to talk about teeth that have become necrotic, and that's the topic for this segment of the show. So dead teeth, teeth that the nerve inside has passed away, it has died, it is non-vital, may be infected, maybe not, because sometimes teeth die from trauma or cracks or accidents, or just trauma from dental procedures can sometimes, a dental procedure that was rough or invasive or aggressive or whatever, teeth can respond to that by becoming non-vital. Okay, so the tissue inside the tooth it's not just, people call it the nerve, right? Because it's so painful when it's touched or impacted. But in there, besides nerves, are blood vessels and connective tissue. And the nerve the pulp can sometimes recuperate from an insult or injury. And you come in and you've got a tooth that's bothering you. Part of my job as your dentist is to figure out whether that is reversible or irreversible pulpitis, it's called, inflammation of the pulp. And there are certain signs that tell us that it is irreversible. Now, there are a lot of dentists that, they want to get on with doing your restoration. You've got a tooth that's got a temporary on it maybe, and it's been bothering you. It's been cold sensitive. It's been, uncomfortable. It doesn't seem to be getting better. What can be done? Can that nerve still recover or not? In a lot of offices, they, time is money. They want to get on with finishing your restoration. They don't want to just, see you 6 times and eventually, put off the final restoration because the nerve is still irritated inside the tooth. Now, if the tooth is improving, I think it's a good idea to wait and watch. It's a good idea to check the how you're biting on a temporary. It's a good idea to monitor the tooth, the symptoms. If the pulp tissue is irritated but not dying, it will be stimulated to produce what's called secondary dentin. And when it does this, it's actually laying down a layer of tooth structure inside the tooth, kind of distancing itself from whatever the injury was. Let's say there's a crack in the tooth and it's gotten a little bit deeper and now the nerve is irritated, but if you give it some time, it can lay down secondary dentin on the inside and seal the crack from the inside and distance itself. And then eventually it may calm down. But if it's injured past a certain point and there's enough inflammation inside the tooth, it will usually just become necrotic. And sometimes it'll seem like it's healed and then it gradually devitalizes over time. And then one day you take a routine x-ray and lo and behold, that tooth hasn't bothered you for years, but there's an abscess at the root tip in the bone. And that's a tooth that died without much fanfare and just kind of has this abscess in the bone that gets discovered on a routine film. So in that case, you have to decide whether you want to get a root canal or not, and whether a root canal can even be done. A root canal treatment will depend on where the cracks are and how far down the root they go. Sometimes a tooth that dies because of cracks will have cracks that extend down the root below the level of the bone, and you'll go into a root canal specialist and they'll look inside the tooth or at the outside along the gum line, and they will say, nope, you cannot save this with a root canal. You have to extract the tooth. That happens sometimes. But what I was saying about dentists, that some dentists may not want to give your tooth a lot of time. They might say, well, it's hurting. How about you just go get the root canal and then we'll finish your crown and it'll be done. And there's a couple of reasons for that. One is they don't want you to suffer, and they don't want a call in the middle of the night that your tooth is blowing up either. And that can happen. Your tooth can go into the kind of toothache pain that is legendary. It's excruciating. It's terrible pain. It's a lot of pressure built up inside of the tooth, or sometimes it has blown out into the bone and you have swelling. It can be dangerous. If it's an upper tooth, that swelling and infection can go into your sinus or into your spaces of tissue in your face and cause a cellulitis. It can go down into, instead of being just in the jawbone, it can slip into the tissue under the tongue and become a swelling that actually can close off your airway. And there are different names for these different, issues, but these are the dangerous things that can happen if you let a tooth abscess and blow up without treating it. But if you're closely monitoring a tooth, you should be able to catch it before it gets to that dangerous stage. But sometimes that's on a holiday, a weekend, or in the middle of the night that it suddenly gets to that point, and suddenly you've got an emergency on your hands. So we don't want to let teeth get to that point or have anyone experience that kind of terrible pain and infection. And you can get sick, and people have died from tooth infections. Yes, it can happen. Not very often in this day and age, but it does happen, and it can happen, especially if you are a person who doesn't have access to care or can't afford care, and then you don't go and get it taken care of until you wind up in an emergency room at a hospital because of, one of these kinds of conditions. So on the one hand, it's, if a tooth is bothering you, maybe it's a good idea to get it dealt with. But let's talk about infections in the teeth and root canals, because even if a root canal treatment is done where the pulp tissue is completely extirpated, which means removed, cleaned out, the canal is shaped, it's disinfected, and a filling material is placed all the way down the root canal, the main canal, to the root tip, sealing out bacteria, supposedly. But the problem is 100% of these, when looked at under a microscope, are teeming with microbes. They're just full of bacteria, and it doesn't seem to matter what the technique is that's used. I don't know whether ozone can completely obliterate all of the microbes, but in any event, even if it did, even if there was a way to completely eliminate the bacteria in the tooth after a root canal treatment, how long does it take for that tooth to recolonize? Nobody really knows. I don't know that any research has been done on this. I haven't seen any. And the bacteria themselves give off toxic chemicals as their waste. And there's a lot of controversy. This is really where the controversy is how toxic are those chemicals. The controversy about root canals is not about whether bacteria remain in the tooth. The tooth can't be sterilized. Every single root canal treated tooth has bacteria living in it, in the tubules. Every single one. Whether that's a problem, how big of a problem it is, that's where the controversy is. And the chemicals that these bacteria give off, are those chemicals toxic enough to be concerned about? Are they toxic enough to cause problems in other parts of your body? That is research that, supposedly got debunked, that a tooth could cause a problem in a distant site in your body, called the focal infection theory. But I don't think it was successfully debunked. I think that the idea of it was declared to be debunked, but actually there's quite a bit of research that seems well executed and valid, and I mean a lot of research on this. So it's just not something most dentists know about or hear about. What dentists hear about in their training is that the focal theory of infection was debunked, and that's kind of all we're told when we're in school and in continuing education later. But having looked into this further, I can tell you that I'm not sure it was successfully debunked. But that's, maybe a topic for another show specifically. But what I want you to know is that when your tooth is dying or dead, a root canal treatment is going to be one of your options. They are legal, and there are specialists that do these. Some general dentists also do them. And it enables you to continue to have that tooth in your mouth. And that's the important thing for a lot of people, and especially practitioners, is that you get to keep that tooth. If that tooth has a lot of gum disease or bone destruction around it, it may not be worth keeping, anyway. But if it's a good tooth and with good bone support, then, usually in most offices, especially mainstream, you're going to be encouraged to get the root canal treatment done so that you can keep that tooth. Now, the controversy about how toxic they are, or whether you want to keep a tooth that's actually basically harboring a chronic infection, I recommend that if you're facing that choice, that you do some research and really decide whether that's okay with you. Take a look at the research that's been done. Look at what people are saying about this and educate yourself. And, the only other option besides getting a root canal in a case like this is to remove the tooth. And that is a very big deal. Losing teeth, especially if it's a front tooth or if it's a tooth holding up a bridge or an important tooth, that's functioning in your mouth in a way that you really will miss it if it's not there, then extracting that tooth is a very big deal. And you need to think about how you're going to want to replace that and what that process is going to be. It's really a huge deal to lose a tooth. So, I definitely understand when people don't want to extract a tooth and they'd rather get the root canal, but they don't like the idea of root canals. This is a tough choice. This is why it's extremely important to me that when I'm restoring teeth, I'm doing it without traumatizing the teeth. I don't want to traumatize the person, and I don't want to traumatize the tooth I'm working on. So my methods for restoring teeth are extremely gentle, and I work a little slower, and I'm not removing any more tooth structure than I absolutely have to. So I might do an inlay or an onlay rather than, or I might do an onlay instead of a crown, because that means I'm drilling less tooth structure. I might do a smaller filling that's irregularly shaped instead of a nicely, symmetrical type of shape for the filling, because it doesn't matter if it's symmetrical. It doesn't matter if it's an odd shape. My goal is to not drill anything that I don't have to. So a lot of times dentists are doing the shape for the filling, drilling the tooth shape in order to do the filling, but they're using techniques that were taught to us in school when we were putting amalgam in the teeth. Now, when we put a bonded resin filling or a plastic filling, we don't have to drill away as much of the tooth, but a lot of dentists were trained in the old ways, and they will still do an old-fashioned prep of the tooth, which is a lot more drilling because we were going to be putting mercury fillings in there. Now we don't have to drill away as much when we're doing a filling, but some dentists haven't adjusted their techniques. So my techniques are all based on the newer materials, what's needed for bonding, and removing as little tooth structure as possible and doing it as gently as possible, because I don't want any trauma to the teeth. I don't want to make any cracks worse. I don't want to cause any nerves or pulp tissues in teeth to become inflamed. And that's always my goal whenever I'm working with a tooth. All right, it is time for a break. You're listening to Dental MD. I'm Dr. Jessica Sapoff. If you have any questions about any of the topics I'm talking about, you can give us a call, 425-427-8899, or reach us by email, appointments@naturaldentist.com. I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
When you look at me, you might see my tremor,
my lack of facial expression,
a person with Parkinson's disease.
But you may not see that I have trouble sleeping,
that no two treatment plans are the same.
I was diagnosed at 65.
37, earlier than most.
But if you look closer,
You'll see
a warrior mom,
an endurance athlete,
Someone who is still dancing.
someone with a lot of fight.
Every 9 minutes, someone is diagnosed with Parkinson's disease.
and every one of them can turn to the American Parkinson Disease Association.
For education.
for community.
For support.
Look closer.
And you'll see
My resolve
My determination.
My spirit
is
unshakable. Visit apdaparkinson.org to learn more and show your support today.
Alternative Talk 1150. It's good for what ails you. This statement has not been evaluated by the FDA.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. I'm talking about choices in dentistry, and I've covered wisdom teeth, and I've talked about teeth that are necrotic or dead teeth, dead pulps in the teeth. And in this last segment, I know I'm not getting to my other frequently asked questions. I'm going to cover those in the next show. I was very ambitious with my initial list, but I'm going to continue talking about teeth that where the nerve has died, because I want to go over, if you do decide that you're going to remove a tooth that's dead, or there's no way to even do a root canal, so that's not a choice for you anyway, and you have to lose a tooth, let's talk about what your choices are for replacing a missing tooth. Had a case recently where a tooth had too much decay. The roots were decayed apart from each other underneath in the bone. I mean, there just was no way to restore that, no way to do a root canal on that. And so that wasn't a choice. That wasn't an option for this particular patient. But the tooth in question happened to be an upper second molar. And this particular patient had every other tooth intact and usable and good chewing surfaces. So it turns out that, when you remove a tooth, you run the risk of other teeth drifting and shifting, tilting. There are a lot of problems that happen if you don't replace teeth, except upper second molars. The lower tooth that chews against that one is also chewing against the next tooth over. So that one is stable and won't be able to drift or shift or tilt or move. And there's no tooth behind the upper second molar. If there's a wisdom tooth that has come in, then there is. But if it's the last tooth in the row and there's no wisdom tooth, then there's nothing behind it to drift or shift. So it turns out that in that area of the mouth, people don't really notice the tooth not being there. Some people need symmetry. They've got the one on the other side, so they want to replace this one so that their mouth is even. That's fine. I understand that. But there's no pressing need to replace an upper second molar most of the time. But in all other areas of the mouth, in the front, you want to replace it for aesthetics and also so that teeth don't drift and shift. And all of the other premolars and molars have to be replaced with something, or at least held in place. And if it's a lower tooth that's being lost, then the tooth behind it could tilt, or if it's the last tooth on the row, the tooth above that one does not rest on any other teeth. That rests only on the second molar if the bite is positioned in a normal way. And so that upper tooth, if it doesn't have something to chew against, or it's not held in place by a retainer or some other device, it will super erupt, it's called, and it will begin to erupt further and grow further. It doesn't actually grow, it just kind of drops down. And you end up with this tooth that's not aligned anymore. It's dropped down, and it'll keep doing this until it hits something. As soon as it hits something, then kind of stops shifting because it's now stabilized. And so sometimes it drops all the way down until it hits the gum tissue behind the last tooth on the bottom. That's a bad situation. And the other thing that happens when the upper tooth drifts down is you end up with a big food trap between that one and the tooth in front of it. So something to stabilize the other teeth is necessary. If it's a tooth that's between two other teeth that you're losing, you've got some options. One option that is pushed heavily in most cases these days is an implant. That is considered top of the line treatment. Everybody wants to do an implant for you. They're fairly simple. In a lot of cases, they're a pretty easy surgery. Not always, and there can be severe complications if they are not done correctly. However, most of the time, it's a fairly simple process and very lucrative. And basically what you're getting with an implant is an artificial root, and then somebody that is a restorative dentist, such as myself, a general dentist, will place an implant crown on the top of that artificial root. And then when you look in your mouth, it looks like a tooth. The gum tissue around this will frequently sort of flatten out after the tooth has been extracted. And so you can end up with kind of flat gum tissue between the implant and the neighboring teeth, which can cause food to get trapped and frequently does. If it's in the front, then that flat gum tissue doesn't look very nice if it shows. And so sometimes you need to have aesthetic gum surgery to try to rebuild the pretty pointy tissue between the teeth that looks natural. Because when it flattens out and you end up with what we call a black triangle between the teeth, that is not an attractive look. So these are some of the things that can happen after a tooth is extracted if you choose an implant. Your other two options for replacing teeth are a fixed bridge, which is where the teeth on either side of the space are shaped, and a 3-unit, in the case where you choose ceramic, it would be all ceramic, that is placed in and cemented to the neighboring teeth. Now, a lot of times dentists will drill those neighboring teeth down to little stumps and have the end units be full crowns, but it doesn't always have to be done that way. Sometimes it can be inlay or onlay units, which are a lot more conservative with a lot less drilling. And let's say the teeth on either side of the space are beautiful, uncut teeth. They've never had any restorations in them. It would really be a shame to cut those and put in a bridge. So in a case like that, you might choose an implant so that the neighboring teeth don't have to be shaped or drilled at all. But if those neighboring teeth have old crowns already, metal, nickel, mercury, other older metal restorations that you were thinking you wanted to replace anyway, that's a great time to do a bridge, because the metal in the neighboring teeth can be removed and replaced as part of doing the bridge, included in doing the bridge. If you got an implant there and you still had metal in the side teeth, you would have to do the implant and the implant crown, and then as a separate procedure, remove the metal on the neighboring teeth and replace those with non-metal and ceramic. So you could do that as part of a bridge without having to pay extra for those side teeth, is my point, because they would be done as part of doing the bridge. So for some people, because of that, the bridge makes a lot of sense. But some people don't want an implant, don't want surgery, and don't want their teeth cut, and don't want the metal replaced, or they don't want a fixed bridge, or they can't afford a bridge or an implant or whatever it is. And so they might choose a removable tooth, or perhaps to wear a retainer at night or something that just keeps everything stable. So a removable partial denture has a tooth on it, and it clasps around your other teeth. They can be made flexible, thin, non-metal. They can be very nice, and you can use that maybe until you make a decision or until you save up for other options. All right, that was all about replacing teeth that are lost, and you are listening to Dental MD. I was talking about choices in dentistry today. I'm Dr. Jessica Sapoff. If you have questions, give us a call, 425-427-8899, or reach us by email, appointments@naturaldentist.com. I'll be back next week. Thank you for listening.
Somewhere over the rainbow, way up high, and the dreams that you dream of.
The views expressed on this program are those of the host, guests, and callers, and not necessarily those of KK.